So, in this segment, we're going to be talking about the NHS furthering crisis, which is in part down to this government's handling of the pandemic, which is, you know, dreadful. The successive governments, the last three, specifically underfunding of the NHS, um, combined with a British public who, at least some people, don't want to comply with the rules, combined with massive delays in lockdowns. So let's look at this video quickly.
The ICU capacity has not yet been overwhelmed in the way that perhaps some of us feared it might be, and that is thanks to the hard work and the professionalism of the staff, the doctors and nurses of the NHS. The answer, and we are seeing, as I said just now, some tentative early signs that.
Yeah, it's full of rubbish. This tweet's from a week ago, but it's still relevant because there's about 4,000 patients in ICU units, and further to that, there are still massive. The deaths are still going up from the COVID cases. So did the Prime Minister really say that the ICU capacity has not been overwhelmed, perhaps as much as we feared? Yes, he did. It's absolutely enraging. You've got patients being taken from hospitals to other hospitals that are much further away, purely because these hospitals do not have capacity to deal with the patients. So if we look here, many NHS staff traumatized by the first wave of virus. So you've got to imagine how bad they're going to be now, considering this wave is far worse. And these doctors, nurses, health officials have not had a break. They have not had a break. So you can only imagine how bad it's going to be for the second wave. Calls for coronavirus masks. So basically, these are masks worn in ICU units. These are NHS staff have called for them to be given more, distributed more widely, because of the new infectious strands or variants that have been let in by the British government, because they refused to lock down airports when they had the chance, or do mandatory quarantines when they had the chance. They're discussing it now, which is a separate video, but still. Surge leaves key hospital services in crisis. So this is from the 14th of January. The surge in COVID hospitals has left key hospital services in England in crisis. Doctors are warning. NHS data shows A&Es are facing rising delays admitting extremely sick patients onto wards. Meanwhile, the total number of people facing long year waits for routine treatments is now 100 times higher than it was before the pandemic. Cancer experts are also warning the disruption to their services is terrifying and would cost lives. And if you look at the excess death numbers, that will give you a further indication of how many people died, not just from COVID, but also from other illnesses and diseases that weren't able to be treated, purely because of the lack of beds within the NHS, which again further goes down to the government. So if we keep going here, protect us from unlawful killing charges, medics. So you've got a story here about medics talking about they wanting protection, legal protection from being prosecuted over decisions made under the pressure of the pandemic. So these are, doctors saying that, look, if we have to turn off the machines for someone to let someone else onto the machine, please do not hold us liable for this, because we are under so much pressure right now that there is not much we can do. The government said staff should not have to fear legal action. Well, I wouldn't believe anything this government says, to be honest. So we've got another story here. One medic saw 8 people die in a shift, and you've got to imagine the mental health toll was taking on these medical professionals. They were already understaffed before the pandemic. They're way understaffed now. There's a lack of everything within the NHS, really, beds and staff. And you've got to imagine how haunting it must be to have to go into work, see 8 people die on a shift. Coronavirus has changed many people's working lives for the worse. Many of us have been isolated from our colleagues. Others have been made redundant by employers, citing the cost of the pandemic. In the NHS and in care homes, through the pressures have perhaps been the most intolerable. 10 months of COVID-19 have left many healthcare professionals mental health at breaking point, according to Claire Goodwin-Fee. Frontline 19 organisation she runs with fellow therapist Ellen Walden, has received more inquiries in the past week than it did over the whole of December. And so, if the government doesn't put the money, give the money to help these NHS staff with time off and therapists and everything that they need to get through the next phase, post pandemic here, it further shows you how much the government have failed our healthcare workers, the best of us, the ones that have pulled us through this. played the majority part in that, at least, along with other key workers, along with, people, fire services, police, people working in shops to keep the shelves stocked so then we can actually buy food, delivery drivers, fast food places, takeaway outlets, all of these places that have played a key part in keeping the country going, but none more so than the NHS. And we owe everything to them. And if the government do not give them proper pay rises, do not help them post pandemic, then that's, it shows you how horrible this government is, but it also shows you that, it's down to us, the people, to fight for these things. And we keep going here. So William and Kate here from Emergency Workers, I really don't care about royalty, but, at least they're talking to people, I suppose. Here, this was a few days ago. This is when I think the deaths peaked. I don't think we'll see death rates as high as this, as long as the cases keep falling down at a steady level. But UK reports 1,820 people dead, as Boris Johnson warns tough weeks to come. And you can see how hard it must be on, the NHS to deal with these sorts of numbers here when they don't have the staff or the beds that they need in order to help people. And it's just a horrible situation to be in. I've covered the amount of deaths before, but it's just horrible, especially when you think about there's a 2-week lag between cases and deaths, so those death numbers could still keep going up. Hopefully not, but it's just the way that the disease works and how the stats look. So you got to hope that we don't get another peak this bad, because it's an abject failure of the government, to be honest. We keep going. Intensive care patients transferred from London to Newcastle. This is something I was talking about. You've got to think London's in the south, obviously Newcastle's in the north, and how far these patients have been transferred in order to be looked after. It's not many, but you've got to imagine how many patients have been transferred to other hospitals that are closer to London. And that shows you how stressed the NHS is as an institution. And we go to our final piece today. So this is from yesterday, 18 hours ago. A number of patients on ventilators passes 4,000 for the first time. So the number of coronavirus patients on mechanical ventilation in the UK is now past 4,000 for the first time in the pandemic. A total of 4,076 patients were on hospital ventilators as of Friday, according to the government. This is higher than the first wave when the peak was at 3,000. It comes as another 1,348 deaths. And so what you can see here is that this second wave has been far worse than we could have imagined with, the peak of the first wave. It says it here somewhere again. The peak of the first wave was at 3,300 on April 12th, and now we've gone over 4,000. It's genuinely harrowing that this has happened. Meanwhile, new figures show that a record number of seriously ill COVID patients are being transferred from overstretched hospitals because of a lack of bed space. And this is something we've talked about before. There is a massive lack of beds within the NHS, and so what that means is patients are moved to hospitals or private facilities. And that takes them even longer to get the care that they need. About 1 in 10 patients admitted to intensive care are being sent to a different site, according to a body which audits critical services. And 1 in 10. There's so many people considering how many people have been sent to hospitals. 1 in 10 people are being admitted to another place, another hospital, because of the lack of beds within hospitals. In a series of reports in the past week, the BBC's Clive Meary has been to a mortuary and the Royal London Hospital, where 12 out of 15 floors are occupied by COVID patients and are struggling to cope. So you've got to imagine all of these floors, right, that were dedicated to other illnesses and other issues have been taken. A lot of them have been taken in order to deal with COVID. That's how bad it is. And even still, they do not have the space to deal with the pandemic. That's how bad things have gotten. Martin Freeborn's wife, Helen, 64, died with COVID-19 at the hospital shortly before he spoke to the BBC. Mr. Freeborn urged people to be careful taking precautions to stay safe from the virus. You don't want this to happen. That's a guy who's lost his wife. At 64, that's not very old. That's not that old. Mr. Freeborn urged people, I've just read that, nobody wants to go through this. Don't end up like us, please, he added. The number of people in mechanical ventilation beds has climbed every day since the 18th of December, when it was 1,364 and now stands at 4,076. It is one of the key figures the government considers when deciding its policy on when to ease lockdown restrictions. When the pandemic was first struck the UK, the government saw what had happened in hospitals in China and Italy and prioritised the provision of ventilators in British hospitals. yeah, and this the rest of this article is not mega important, but what we can tell from this is that people in hospitals are being treated differently from the early days of the pandemic, which may explain why figures suggest slightly more people go on to recover after being on ventilation than back in April. We've seen more kind of treatments that have come out that are more best practices, I guess, on how to deal with patients on ventilators who are suffering from coronavirus. Um, they include the steroid dexamethasone, I've not said that correctly, which has been shown to reduce the risk of death by a third for ventilated patients and a fifth for those on oxygen. Encouraging results have also been reported from two anti-inflammatory medications. Yeah, I can't read those. You guys can figure that out. But what we can tell from this is despite the fact that we have better medicines to deal with, the pandemic to help prevent deaths, the deaths are still very high, and that's alarming. You've got nurses are broken. So Dr. Amy Jones, intensive care consultant at Aneurin Bevan University Health Board in Wales, said there has been carnage for the last few weeks. Speaking whilst on shift, she told BBC Radio 4's Today programme, "We may be at 150% capacity, and I know London are much worse than that. We are a steady stream of fit young patients. We have a steady stream of fit young patients requiring critical care, and sadly we're losing some of those patients. You've got even young people dying, so no one is safe from this. It's heartbreaking, and it's been going on for a few weeks, for weeks and weeks, and we haven't seen any kind of stop yet." Dr. Jones said the average COVID patient stays in hospital between 2 to 4 weeks, and it really puts them through it. And you got to imagine how long a bed taken for 2 and 4 weeks means that that bed is used, and that because there's a massive lack of beds, given how long it takes for treatment of patients, you can see why, one of the reasons why the NHS is struggling for bed space. She added, "You really want people who are going to be able to survive that 3 or 4 weeks and actually come out of the other end and make a good recovery. We're not stopping people having care, but we're giving it to people we feel have the best chance of getting through what is a horrific situation." And what that's telling you is they're rationing care based on someone's health. So if you're older, if you have pre-existing conditions, they might not be able to look after you because they're looking after people who have a higher chance of success. Very similar to the film I, Robot, where instead of saving the little girl, because she's a little girl, the robot opts to save Will Smith because he had a higher chance of survival. And that's what's going on here. Care is being rationed, and that's down to the government's failure to deal with the pandemic and also fund the NHS properly. They're the two key factors in this, and that is why so many people have died when they did not have to die. Dr. Rupert Pearce, a consultant in intensive care medicine at London University, speaking on behalf of the Intensive Care Society, told BBC Radio 4's programme that a huge number of patients were still attending hospital. He said, "Whilst we know that the infection rate has probably now peaked, and we are hopefully we can be hopeful to be soon to be sure we've hit our hospital admissions peak. Admissions to ICU, the intensive care unit, usually lags 48 hours behind that. So we're still very worried that we're being pushed right up to the wire in terms of the resources we're able to deliver for patients." You can see here, 37,899 patients in hospitals. That's from the 21st of January, so it's only from a few days ago. You got daily deaths increasing. The 7-day average of 1,248. Obviously, we know the numbers are higher than that, but that's just the average over a week. What more can we say apart from the fact is that when this is over, an inquiry has to be done into many of the decisions the government has made, and I don't know how you just give them pay rises and just treat them properly. That's my advice to the government over the NHS. Give them pay rises that they deserve. Give them the funding that they need in terms of staff and in terms of beds and other facilities. Give them access to therapists and medicines that they're going to need to help them through this, because a lot of them are going to end up with PTSD, and a lot of them won't be the same after this. And if they do not get the help that they deserve, that shows you a failure of not just the British government but also of the British people. But yeah, I'm going to leave it there. Let me know what you think in the comments below. Like, comment, share, subscribe, and hopefully I'll see you in the next one.